Hi, everyone, and welcome to the Clinics Review Articles podcast series. I'm Taylor Hayes, the managing editor for Physician Assistant Clinics here at Elsevier. PA Clinics is a quarterly publication that provides deep insights into the latest advancements in the PA field. Our clinical review articles address the key points, diagnosis, prognosis, clinical management, and complications of disease and techniques, evidence, and controversies in the field. Joining me today is consulting editor Gerald Cayingo to lead the discussion. Today, we will be discussing the July 2025 issue on urology, guest edited by Molly Ban from Yale New Haven Children's Hospital and Victor Quintanilla from Yale New Haven Hospital. Thanks for joining us, and over to you, Dr. Cayingo.
Thank you so much, Taylor. I'm so happy to be here today. Our July issue of PA Clinics podcast focusing on urology. My name is Gerald Cayingo. I'm the Leslie Robinson Endowed Professor of Health Professions here at the University of Maryland, Baltimore. I'm also a practicing PA focusing on endocrine system and diabetes. I'm so thrilled to really discuss this problem of urology. As the U.S. population is getting older than ever before, urological disorders are still rising and increasing. The demand for urological medical and surgical services will continue to increase. Unfortunately, a significant portion of the urological physician workforce is nearing retirement. A lot of folks are putting their stethoscope up and going into retirement. So more physician assistants and physician associates are needed to mitigate this growing shortage of urologists. I'm very thrilled to be joined by the editors of this urology issue. So join me in welcoming PA Maury and PA Victor to walk us through this issue of the July 2025. Maury, up to you.
Hi, I'm Molly Band. I am a physician assistant practicing currently at Yale New Haven Hospital, practicing in pediatric urology. And my co-partner in this project is Victor, who also works at Yale in adult urology. I'm just going to first walk us through our articles, just so you get a broad scope of the topics that we discussed, and then we can go a little bit into more detail about the important topics and why we chose this particular table of contents. First, starting off our article, we have two fabulous articles on pediatric topics. The first one is a review of congenital abnormalities in urology. And this article focuses on disorders of the urology system that children are born with and carry through their lifespan. Our next topic is pediatric urology, avoiding dysfunction in neurogenic bladder. And this article focuses on lower urinary tract dysfunction in children, including constipation, as well as neurogenic bladder that's inclusive of patients diagnosed with spina bifida or other neural tube defects. Then we move on to female urology and pelvic floor reconstruction, and it encompasses both medical and surgical management of urinary incontinence, overactive bladder, and pelvic organ prolapse. Our next article switches over to men, and we're navigating common disorders in male sexual reproductive health with a focus on primary care perspectives for erectile dysfunction, hypogonadism, Peyronie's disease, and varicocele. We next did a topic on gender-affirming genitourinary surgery and their associated care, so pre-surgical, the surgical management, and then post-surgical complications and management. We have an article on neurourology and urodynamic studies in adults, understanding bladder function and disorders. And our author for that topic spoke about MS, stroke patients, and any neurologic disorders that can affect the bladder. Then we move on to a fabulous article on kidney stones, both the medical and surgical management of kidney stone disease. Our next article is health disparities in urology and why it's so important to tackle them. And we have a fabulous article on end-stage renal disease and renal transplantation that discusses disorders that result in end-stage renal disease, and also all you can know about kidney transplant, deceased donor versus living donor, the medical management and complications following transplantation. And then we have an article on urologic emergencies, focusing on 5 disorders not to miss in the emergency room, including urinary retention, Fournier's gangrene, testicular torsion, priapism, and paraphimosis. And then our last article is a basic overview of genitourinary cancers, and it spans all genitourinary oncology processes.
Wonderful. This is great, Molly. Indeed, you guys have put together a concise urology guide for PAs, both in primary care and in specialty care. And I think these carefully selected chapters really showcase the most current evidence on prevention, diagnosis, and treatment of urological diseases across the lifespan. I'm so glad to see that you have included both the elderly and the pediatric population. So you have covered almost every field, on both populations. So I want to go now to ask you a few specific questions. And I want to start by understanding, why did you choose these topics or chapters for this issue?
This is a great resource for PAs that are practicing both in primary care, but also in subspecialties. A lot of the topics that we chose are the urologic disorders that are more commonly seen and can be seen across multiple specialties. And I think it's a really great education and overview so that folks feel comfortable seeing some of these disorders in their practice, but also knowing when to refer.
I agree. I think this just gives us, a great general overview of the many topics that, we see often in our practice from inpatient to outpatient. And it just really covers everything from kidney stones, like Molly had talked about, all the way to, all the different GU malignancies, and everything in between, essentially.
Right. So what I'm hearing, you created this list with a PA in mind, making sure that PAs, whether in their primary care setting, whether they are in specialty care setting, don't miss some of these common urological disorders. Is that right?
That is correct.
Absolutely.
Wonderful. So are there any new urological guidelines, whether screening or treatment, that you came across in this issue?
I don't think we put any specific guidelines that were brand new, but I do think that a lot of the topics are time sensitive, including like the emergency department, and then also, a lot of discussion about the health disparities, as well as the article on the gender-affirming genitourinary surgeries. I think a lot of those topics we're seeing as hot topics in this day and age. So wanting our providers to be aware of what they could see, or if there's going to be an influx of patients that are coming in, so that they're up to date on these disorders. Wonderful.
What about in the area of cancer? I know cancer is one of those big areas that keep changing. The time by which we screen for prostate cancer, the use of PCA and stuff like that. Is there any new changes there?
I know there's, updated guidelines on things like microhematuria per se, and looking for getting a detailed history and physical to look for, any chance of malignancy, going over a thorough family history of, urologic cancers, environmental factors, occupational exposures, things like that, use of tobacco, and just really emphasizing those things to basically preemptively look for those risk factors and catch them at an earlier stage than down the road. There's updated guidelines over the years of how to treat urinary tract infections. And then there's also some guidelines about, antimicrobial stewardship, to basically combat antimicrobial resistance. Those are some topics that are kind of current and ongoing, as far as, I don't want to say per se guidelines, but, maybe new screenings and topics that I know of.
Wonderful. Yeah, I totally agree with you. Just only to add that I think in April 28, 2025, just 3 months ago, the American Urological Association also released the new guidelines on genitourinary syndrome for menopause. Can you mention a few things on that?
Especially as women are getting older and undergo menopause, there's a lot of symptoms associated with that. But that's kind of the extent of what I know. But that is a hot topic, if you want to call it.
The 2025 guidelines for genitourinary syndrome of menopause focuses on the stepwise approach, including using lifestyle modifications, over-the-counter options like vaginal moisturizers and lubricants, and then going toward hormonal therapies, both local and systemic estrogen, and then moving forward with other medications, just sort of more of a stepwise treatment plan.
Wonderful. Thank you, Mario, for that. Talking about guidelines and screenings, modifications, how about medications? Are there any new medications that are covered in this issue?
Yeah, one of the medications that is newer in terms of specifically for pediatric practice, but is also used in adult practice, are the beta-3 agonists like birabegron and mirabegron. And we're starting to use it a lot more for both overactive bladder, and in the pediatric population, we also use it for patients with neurogenic bladder. And it's really been a game changer for a lot of our patients, not only as an augment to oxybutynin and other medications, but it works really well, and the side effect profile is a lot more tolerable than oxybutynin.
Yeah, the field of pharmacotherapy is always changing and changing very fast, especially with the use of new tools like artificial intelligence and others. I'm sure we're going to be seeing more and more changes, and these changes happening more rapidly than ever before. So,
absolutely,
yeah. So, I'm wondering for our listeners, PAs, practicing PAs, students, employers who don't work in urology on everyday basis, they're probably wondering, how does a typical day look like in the life of a urology PA? Could you paint a picture for us on how a typical day would look like for a PA interested in working in urology?
Yeah, I was just going to say, I think you have, between myself and Victor works mostly inpatient and I work mostly outpatient. So we can, between the both of us, we can give you a good idea of what a day-to-day looks like. My practice is specifically pediatric urology outpatient, but that is inclusive of seeing patients in the clinic for their chief complaints. We'll do full history and physical exam on patients in clinic, and also do office-based procedures like uroflows and bladder scans and collection of urine samples. And then my role also involves doing urodynamic testing for patients with progressive lower urinary tract dysfunction, as well as neurogenic bladder. So a lot of the day-to-day is in clinic, evaluating our patients, diagnosing and treating patients, doing follow-ups, prescription management, ordering studies like ultrasound or CT scans, and then procedure-based. Victor, can you comment on the inpatient side?
Yeah, absolutely. So I've been an inpatient PA for 21 years now, and my day essentially is a mix of taking care of floor patients. I am also in the operating room as well, doing a lot of robotic surgery. We started the program here back in 2005. Here we're one of the first hospitals in the state of Connecticut, so it allows me a lot of time to be in the operating room, but also be on the floor. So that includes taking care of the patients on the floor. It includes doing consults in the hospital that we get called upon. It includes emergency room consults and admissions. And includes taking care of discharging my patients, prescriptions, and everything in between. But I like the balance of operating and also taking care of patients the best, and that's why I've enjoyed it for this long.
So urology is a great field for somebody who is looking forward to that type of balance where you can do procedures on one time, but you can also do non-procedural care, so to speak. Is that right?
Yeah, absolutely. And I mean, it obviously depends on the institution that you work for, right? So, with Da Vinci robotic system that we have here, that gives me the opportunity to be in the operating room a lot more than doing any general urologic procedures that a lot of our residents here do. But it allows me to assist and also be on the floor, which again is a nice balance that I like. I like best. So it depends on the institution, but where I am, have that great ability to do both, which I enjoy.
Interesting. I think one of the fascinating areas for me in urology is on the younger side, especially kids who are born with congenital disorders, also addressing issues of adolescence. I'm wondering if you have any comments given the various chapters that was covering this issue.
Yeah, it's one of the reasons why I wanted to include the congenital disorders in this article. I certainly am biased. I've been practicing in pediatric urology and nephrology for 13 years. My perception is a lot of adult providers sort of brush over the pediatric section. Like, this doesn't apply to me. I don't need to focus on it. But I really want to remind folks that these kids are living a lot longer and healthier lives with the medical advances that have been made in the recent decades. So these kids, even though they're children that are born with these disorders, they will age into the adult population. So having adult providers familiar with disorders of congenital urology, posterior urethral valve, disorders where their bladders are abnormal from the time that they're born, these kids are going to age into the adult world at some point, and having sort of that transition of care between the pediatric world and the adult world is super important. If you think about adolescence in general, it's such a tumultuous time in their lives. They're trying to figure out their independence and trying to really understand their medical diagnoses, and having providers that are familiar with that important transition period is super important, so that there's no gap in care. They're not missing out on screenings that they need, or they're not missing important medications that need to be prescribed, so that they continue to be healthy.
Yeah, I agree with you, Maury, that transition can be extremely difficult. We see the same problem in endocrine, especially for people who have type 1 diabetes, who have been managed as young kids. Now, when they're transitioning into adulthood, that transition can be extremely hard for both patients and also caregivers. So I would think a similar phenomenon does happen in the urology field as well. So I think when we go to school, we focus a lot on the clinical medicine and also on the biological sciences, the pharmacology, the urology, the physiology. But one of the other interesting areas of medicine is what we call the system science, the ability to coordinate care, the ability to focus on access to care. So I'm wondering, in the field of urology, to both of you who work every day, how do you manage coordinating care between different practices, and how do you ensure that reduce disparities in care?
Yeah, I think it is really hard to be able to be that provider that is able to foresee the different needs of the patient. Oftentimes, I think being in a specialty, we're sort of siloed and like to think that this is the only thing that we're taking care of. But particularly in these complicated patients where they have multiple systems affected by their disorder, I think that communication and coordination is really important. Particularly in pediatric urology, such as our kids with spina bifida, they have lots of different specialists, and even they come to us more than they go to their pediatrician even. So being able to coordinate with neurosurgery and orthopedics and physical therapy, I think really trying to be conscious of that communication and making sure that all of the different providers that are involved in patients' care is challenging, but also really important.
Definitely. So as you think about the future of urology and looking at the various forces that are shaping healthcare today, what's your take on urology for tomorrow and beyond?
Again, I'm trying to think about the inpatient setting, right? And I think just the fact that we have an aging population, right? People are living longer. As that occurs, we do see a lot of GU issues related to those, some easier, some difficult, more difficult to manage, and access to healthcare. Some are patients not having family or relatives around to help them get to appointments because they are older and they don't have anybody. I mean, those are the things that I see that make it difficult in the inpatient setting.
Yeah, I'm wondering how you see technologies such as AI, how they're going to influence the future of urology.
I think it's really exciting in urology. This is not necessarily my area of expertise, but just doing some research on it, there were articles, even 5 years ago that were referencing AI in urology. And I think more recently, there's been a lot more development and practice put into place about what AI can bring to the practice of urology in all stages of care, from the preoperative stage, in the operating room, and then like post-operative management of complications. So it sounds really exciting for urology practitioners to introduce into their day-to-day.
As far as AI goes, I mean, I think we're in what I call the infancy of AI, right? I mean, it's still pretty novel and we still don't know everything about it. So I think there's a lot, coming down the line in the future with AI. The things that I see on our end is, it has helped. It can basically help look at images and find things that maybe a human radiologist may miss. So it may assist with those things. I've seen that doctors are now using AI to dictate their notes as they're seeing patients, and it'll help them in that sense. It can help provide information quicker, whether that's to the physicians or the patients, to help them understand what's going on. But that's how I look at the AI. And as far as for me with doing robotics, I'm not sure what AI is going to lead to down the road with the robotic system, but I'm sure it may improve what we can do surgically as well down the road.
So the future is very bright, what I'm hearing. So AI will probably make diagnosis quicker, probably more precise, maybe reduce the time it takes to do the procedures that people need to do. It will probably augment robotic surgeries that are going on these days. But also, probably to add, is the area of precision medicine. We'll probably see a lot more individualized care. We'll probably also see a lot of genetics, monoclonal antibodies being developed to target certain cancers. I would imagine that telemedicine is probably already being utilized in urology. I mean, for some of your patients, especially in the outside settings, you probably could see them without necessarily coming in the office. Is that right?
Yes, good or bad, COVID kind of started that whole process of being able to have video visits and telehealth, to where patients don't have to come to the office, and if they have trouble coming to the office, we can still communicate with them, as we are doing today, and have conversations and discuss concerns and stay in contact with patients so that we don't lose sight of things, and we have consistency with their health moving forward. That's how I see it.
Thank you so much, Victor. It has been a great pleasure to really hear your discussions and breaking down this issue of urology. I'm very convinced that this resource is going to be great for PAs across all practice settings, and it will equip our PAs with the latest knowledge, skills, and procedures to take care of patients with urological disorders from head to toe, sorry, from young to old. Thank you so much for your participation.
Thanks so much for taking the time to speak with us today, and thank you to our listeners for joining us for this edition of the Clinics Review Articles podcast series. For an exclusive discount on the issue we discussed today, focusing on the July 2025 issue on urology, visit us.elsevierhealth.com/expert. PA Clinics is available for individual print subscription with accompanying online access, as well as individual online-only access, and is also available on the Elsevier's electronic platforms Clinical Key and Science Direct. For more information on this series and our nearly 65 other titles spanning all medical disciplines, visit info.theclinics.com. Be sure to follow us on Twitter @Clinics Reviews and subscribe to the Clinics Review Articles podcast wherever you get your podcasts. Thanks for listening.